I am Naranjan Dhalla from Winnipeg. I am a distinguished professor at the University of Manitoba, working at the St. Boniface Hospital at the Research Center. And I have just presented an article here at the very beautifully organized conference in Boston here. My topic of my talk was the new strategies for the development of drugs for the treatment of hypertension. And you know, hypertension is a very complex problem, and wide variety of drugs have been produced, and actually it's a multi-billion-dollar industry where a lot of benefits have occurred up till now, but essentially it's not really satisfactory up till now. So there is a tremendous search for development of new drugs. So I thought that we should produce something, talk about certain things which gives new information so that other people can help in development of new drugs. And here, most of the drugs which are based on a receptor blockade of the in the smooth muscle, and they block the influx of calcium so that the smooth muscle constriction is reduced, and the hypertension is a little bit relieved. But none of these drugs are really effective. We recently found out that there are receptors present in the smooth muscle which are called lysophosphatidic acid receptors, and they when they are activated, they also produce hypertension, and there is some agents were available, SKF compound and gadolinium compound. There were two compounds we tested. We found out that they produce the antihypertensive effect, and these effects were, in fact, the SKF effects, antihypertensive effects, were synergetic to the already existing the L-type calcium blockade, verapamil and nifedipine. And so it was a very interesting study that there was the potentiation of the existing drug present there, and we also found out that there is a calcium which is increased by wide variety of drugs and hormones, and also increased by lysophosphatidic acid. They are having a synergetic effect with verapamil in this case, and it's a very interesting that we found out that even the cell proliferation, which is involved with the remodeling of these smooth muscle, that also these two drugs, for example, this verapamil and calcium antagonist, and this SKF compound, they have a synergetic effect. So I think there is the best way, maybe in our judgment, is that a clinical trial should be run where the existing L-type calcium blocker like nifedipine or verapamil, they should be combined with some store-operated channel, and they could be very helpful for treatment of hypertension. Or some new compounds can be generated for producing the blockade of the store-operated calcium, and that could be helpful. So both ways it could be a win-win situation. Thank you.
Okay, now let's talk about the Congress, because you had some really nice things to say at the opening ceremonies today. How important do you think it is for people in all areas of cardiology to attend events like this? Because, like the medical information, what's fact today can evolve. How important is it for people to attend this event?
I think there is a tremendous benefit involved, particularly when there are a lot of fellows and students who are young investigators. We believe that they are the future generation of investigators and the future physicians. When they interact with the people who are seasoned and established investigators in the field, so they learn quite a bit in this type of conferences, and so there is a mentoring process going on. So this is one aspect. The other aspect is that people do talk about something latest information, so the exchange of the information is helpful in building collaborations for this. So I think meetings like this are very essential for this, and it's not easy to organize a meeting. I mentioned in the morning at the opening ceremony that I think Professor Kimchi has been doing a great job, and his meetings are successful because he has built a core friendship, extraordinary friendship with people all over the world, and that's why people attend this meeting. They are very enthusiastic about attending this meeting, and particularly, you see, this is important that the basic science study should be translated into the clinical setting, and this is the type of meeting which helps to do that. And I think there are very many benefits one can see from this type of meeting.
And let's be honest, the big phrase these days is think outside the box. When seasoned clinicians and researchers rub elbows with the younger generation, those are the generation that are probably thinking outside the box. They're thinking in new ways that maybe if it hasn't been done that way in the past, maybe they go, well, why not try it that way? And maybe it's the spark we need to get some...
I have a great faith in the future generation of our physicians, which are very innovative people. They're really concerned about finding out the cure, although a lot of people have been trying very hard. But you never know who's going to be successful in only very few. It's a very complex situation. Any disease process is very complex, and particularly cardiovascular problems are too many to confront with, and very complex.
Thank you very much.